Good evening. We meet again at the live webinar with Dr. Florinela Stoianovici. I am very excited and happy because we bring healing through the knowledge of Dr. Florinela Stoianovici. We have a lot of cases to discuss today, and we must continue our discussion about chakras because we received a lot of messages. Thank you for this meeting, Florinela Stoianovici. Let's start with the discussion about chakras and the question related to the connection between chakras and energy. What are chakras from an energetic point of view?
Chakras are some medical scientific information you will see in holistic medicine. We decided to call this webinar today Chakras Between Science and Ignorance, because you will see that it is a form of ignorance, as in this century, in this period, in which we have managed to evolve so much, not to inform ourselves about chakras, not to put them into practice, not to use this information to heal in the medical world. You should know that in holistic medicine, from this perspective of quantum physics, there are some transformers. Here we have some transformers that cannot be seen, because they cannot be seen, they are transformers of subtle energy. In fact, they represent some organs, just like our organs, such as the liver, kidney, heart and the other physical organs. Chakras are some organs that are part of the subtle anatomy, that is, the anatomy that is not visible to the human body. There are some paranormal receptors, and here the word paranormal is used because it is parallel to normal, that is, different from normal, different from what we see. Paranormal does not necessarily mean that it is something extraterrestrial, but it is something that we are not used to. It is not normal for us, because our eye does not perceive it. There are some paranormal receptors in our subtle bodies, many bodies that dress the physical body, and that together form the aura. It is more about a superimposition, as you can see in the image behind me, of several chakras. Here you see 3 chakras, at each one there are ice cream cones, 3 ice cream cones superimposed, these are the chakras, one on top of the other. So we are actually talking about a superimposition of the energetic centers of various bodies, because there is a mental chakra, there is an astral chakra, and an etheric chakra, which occupy that space and are in pieces like Russian dolls. How do the chakras work? You have to know that the energies from the mental plane are processed by the mental chakra. Then this processing, this pre-worked energy goes and is transformed. Then it goes to the astral plane. There it is taken over by the astral chakras, pre-worked, transformed and goes further into the etheric chakra, then processed again and attention, through the nadis. The nadis are a kind of, beyond the chakra. That is, they are a kind of energetic plexus. That is, they are a kind of energetic plexus, a kind of energetic nodes. And through these energetic plexuses, attention finally reaches the nervous centers, or nervous plexuses, which are immediately found in the chakras, such as the nervous plexus in the solar plexus area. That's why it's called the solar plexus. And then the glandular, such as the solar plexus, we have the pancreas gland, but in each plexus and in each chakra, in the back, physically, there is a gland. So it also activates the gland, corresponding to the physical body, and from there to each organ and from there to each cell. So there is a movement of energy from the upper bodies, in the physical body, up to the organs and to the cell, and the scientific work that I want to declare today, of quantum physics, which proves the functionality of the chakras and their existence, is this puzzle work that exists between the subtle part, respectively the chakra energy, and the part of the nervous system and the gland and the endocrine system, through which they make the transition to the organs and then to the So there is something here that receives energy, and of course what receives energy is the nervous system, and it is normal to suppress the nervous system through the nervous plexus, and secondly, the glands and chakras, which execute what the nervous system says, and take it further at the informational level, through hormones, for example, or neuromediators of the nervous system, they take this information to the cell. So each chakra is actually connected to a nervous plexus, and to a corresponding glandular center, and this is actually the thing that quantum physics has discovered in holistic medicine. And then you will see that this thing has some repercussions in healing and in finding the possibilities to solve the situations in medicine that we do not have in conventional medicine. Also, each chakra is associated with a physiological system. For example, the neck chakra is associated with the thyroid gland, but also with the respiratory system, the jaw and the cervical column, i.e. the afferent organs. The heart chakra is associated with the heart, but also with the circulatory system, which is very important and which, you should know, is not owned by anyone, but is owned by the heart. Also, and by the way, the brain vascular accident is a problem of the heart. It occurs at the level of the cardiovascular system, at the level of the mind, at the level of the head, but it is a problem of the heart chakra. Also, each organ has a frequency of attention, an energetic frequency, which we access at Rayocomp, through the devices designed under the pyramid. In Germany, and we talk with each organ, with each cell, with absolutely everything that is in the body, we talk energetically. We emit a certain energy, the organ and the cell respond. We emit that we want to break the calculations, for example, at the level of the kidney responds, yes, I will break them. In other words, it is a vibrational language, a language on frequencies. And also, I want to tell you that each organ has a frequency, as I said, but the organs that have the same frequencies are in the same area of the body. For example, the solar plexus chakra is related to what is found in the area of the stomach, pancreas, biliary vesicle and liver. A deregulated chakra, for example, is physically manifested as an ulcer at the level of the stomach, biliary calculus, at the level of the biliary vesicles, pancreatitis, for example. The causes that affect the chakra can be, what do you think? It can be in many ways. We get sick due to the affection of the chakras, but we get sick due to other factors. For example, at the level of the chakras, the causes are emotional, mental or spiritual, and at the level of the physical body there are toxic factors, environmental factors, chemical factors, bacteria, viruses and all the others. I'll take a break from the Kande to take a question from our viewers.
I know you've actually prepared a case, a special case to present to those who are watching us.
Yes. I wanted to present it immediately. If you want, we'll present the case now. We are ready and then, if you allow me, we'll continue with the answer to this question, because I still have something to say. But, as a matter of fact, I would like to present the case first. I would like to put you on the phone to hear the patient's response. I would like you to hear a healing jump. I considered it necessary, and with the patient's consent, you will hear a voice message on WhatsApp that the patient sent me, which was the sweetest melody I've ever heard. It was a healing jump, a spiritual jump. In fact, at that moment, the patient healed and you will hear it immediately. But I want to present this case to you. We will try to show the situation a little. Look, it's about. The lady is very nice, but I cut the lady's name here, if she wants to introduce herself. She is 65 years old and you see that she came. It was a very interesting case. She comes from another locality, a few hundred kilometers away from Bucharest, and I want to tell you that she came with a depression. Where is the depression seen? It is seen in the area of the blue head, as you can see. Also, at the level of the lungs, the red is observed and at the level of the liver. Everything that is yellow and red is not good, but also everything that is at the level of the head with the blue head closed is not good. And we see that at the level of the throat there was a blockage. We are talking about a blocked chakra, observe. We are talking about chakras now. The blockage here at the level of the throat, on the throat chakra, and what is above is with a minus, that is, it is with the blue closed, it means depression, that is, an energy minus. What does this mean? That in the area of the head there is no more energy. Why is it? The lady has an energetic cord around the throat. And this means that the whole head is at the level of the nervous system without energy. Do you know what a nervous system looks like? Or a thought without energy? The emotion of insecurity appears. Fear appears, insecurity appears, uncertainty appears. You can see that you have a headache, dizziness, lack of confidence, dizziness, you don't know what's wrong with you, you have amnesia and disorientation, it's like your GPS is broken and you don't know what to do, you forget where you are, something like that. And below, you can see this area with the red color at the level of the lungs, at the level of the liver, you can see there, what do you think? There is a lot of energy, and tumor formation can appear. And there are always diseases above the blocked chakras, that is, the lady may have a brain vascular accident due to a thrombosis at the level of the head, or she may have advanced depression, which in fact was, and so on. And also, in the second part, you can see, the first time it was on the 17th, and it came for 5 months, 5 to 6 months, on the 21st, 6 years ago, and it still comes to us. And last time, when it came, I noticed that it healed a lot, at the head, the depression part disappeared, and also at the lung it disappeared. So the lung healed completely, the rest is only half, and many of the digestive area of soul pain disappeared. If we go to the next case, we see here the next design, we see how the lady's meridians are on the 17th, very high, everything with yellow is not good and there are many, 1, 2, 3, 4, 5, 6, 7. The first one is pericardium, lack of self-love, lack of, H means heart, in English it means lack of personal affection, not that the lady is not loving, she is very loving, she helps everyone, she loves her teeth, she takes care of her teeth. Then spinal pancreas, CP, that means there are infections in the body, fear rhinitis, you will see that in fact at the base, behind these things, there is a fear, there is a very powerful kidney infection that the lady has, and then many other things. Yes, many other meridians. We go further, here are the meridians after healing. Look how small and calm they are. They are smaller and lower. The healing did not end, but another one occurred. Because these meridians are almost like the green ones. They are a little more than the green ones, but they are about the same size. At that moment, there is very little time to turn them from yellow to green, to understand that it takes very little time. And here I would like to show you the last flash, the last image. We see in this right part, I don't know if you can see Alice's mouse, do you see my mouse? When it works, you don't see my mouse. Yes, yes, yes. Here we see that there is a problem, in the sense that she has a renal infection. And by the way, I removed a lot of renal infections. And to tell you a little, I will tell you, because I have a big surprise, she agreed to come live with us. She even insisted, and I was very happy that she did this, because it is very important to have witnesses for healing. But before Mrs. enters live and we invite her to meet a special person, you need to know that I want to tell you what it is about. I had a first interaction with Mrs. She was sent to a clinic in Oltenia. And from there, the clinic sent her to the lady and told me that Danza, as she came, was very weak. But she was so weak that she lost a lot of weight, that she couldn't walk in a mirror. And outside this mirror, when she was lying on the bed, she said, "Doctor, because I don't have muscles, my bones hurt, I can't stay lying in bed." And she was almost desperate, of course, because she seemed like a person who was losing her mind and going towards something that was not good. And she was, of course, in a very worried situation. And I had a lot of diagnosis of 5 autoimmune diseases, I want to tell you. And when I saw the situation, Danza will tell us what diseases were related to muscles. She had a kind of severe muscle pain. And I put another diagnosis, beyond the diagnoses of my colleagues, and I suspected that this massive weight loss is related to a very deep depression. And I treated her with a depression treatment during this period. Until you saw in the first flash. I'll show you now, you saw that I removed the depression. Here is the depression removed. Observe. I mean, at the level of the head, before it was, you can't see it here. I don't think it shows, it doesn't show because there are no pictures. It was -70 and now it's probably 0. And that's what it means. And after this, the lady lost a few kilograms. When she lost a few kilograms, it occurred to me that there was another problem. At the level, she couldn't bend well, and it was normal that she had a blocked chakra, and she had a blockage here. She couldn't eat well, if I remember correctly, with water. I don't know, I hope I'm not confusing it. Now Danza will tell us. She bent with water, she had to drink water to bend, something like that. But it was because of the blockage. She started to have a problem in the back of the spine, very hard. She went to the doctor again, and they gave her these very serious diagnoses of the back of the spine, which were going towards surgery. And I told her that either she interrupts to go, to consult, to be afraid that we will give her depression again. Or I can't take it anymore, because I can't break my tooth. Because even at one point I threw this thing away. I think you don't want to get well anymore. I think I'm going to get well and you don't. And I say, this thing is only done by a certain personality, and certain dominators, through victimization. And it's like you're victimizing yourself. And after we had this conversation, I will tell you what answers she gave me. You will hear it with everyone, because it is very interesting. Danza made an effort to come to me, she came from afar and so on. And I would like you to tell us how you feel.
I've been thinking about the discussion we had yesterday, about what you told me, that the searches I've been doing for 2 years now are because I'm a victim and I want the attention of those around me. I thought that maybe it would be time not to look for anyone and to look for healing in me. I will continue to come to you as long as my financial possibilities allow me. And another thing I would like to tell you is that before, the people who met me and told me that I looked in a certain way. I told them what I went through. And I realized that maybe this is the position of a victim. But starting today, I will work more on myself, because I took a course in which I learned to work on my inner self, and I also work for my own healing. And I think it's time not to look for solutions outside, because I see that regarding the balance I have, and the problems I have with my muscles and this muscle atrophy. I haven't seen any improvement, and then I will have to work more on this inside of me. Anyway, thank you very much for the patience you have with me, and I have the conviction, I live with the conviction, that healing will come to me at some point, but I have to be patient, because just as the disease came in years, so will the healing. Thank you very much, and have a wonderful day.
And this is called the spiritual jump. Because, I actually realized, it's an interesting thing. I'll close the screen here so we can invite her live. But I realized that there was actually a problem related to. 1 second.
The message was very strong.
Yes, the message was very strong. Yes, and then I thought that the best. I will invite her. Mrs. will have to come in, because I can put the video on, but the audio will have to decouple Danza. Please, let's see if I succeeded, yes. Good evening.
Good evening.
Please, let me give you your hand, to come in with the audio, please.
Done.
Good evening, Mrs. Good evening.
Good evening to all of you.
I allowed myself, with your permission, to reveal a few things related, from my perspective as a doctor, and to give this example to you, because you are a very high person, and you are a well-prepared person, and with you it can be easier to talk, and that's why I was very happy that you agreed to come in and tell us a few things about. What is your conclusion?
I am very happy that you chose to present my case. I am a little bit emotional.
But it's normal. You are the first patient in holistic medicine who comes out to say something.
I am aware that it is possible to be many people in the situation I was in. For me, the jump, how it happened, and I consider it very important, like the moment we do the jump, which was actually partial. I consciously considered that I am a strong person and that I can overcome. That's what my consciousness was telling me and that I wanted to heal. But I realized at some point that in my subconscious it was the opposite, that in fact I did not want to heal, that in fact I felt good in the position of a victim, and I was looking for understanding and compassion of those around me, because there was suffering behind it.
You identified it very well. I did not expect you to make it so short. I did not talk about it. Congratulations.
At the moment I realized what the suffering behind it was. I also realized what was important, that acceptance came. I said that at some point we feel certain things, but we do not accept them. The moment I accepted and I was aware that in fact I wanted to heal only in a conscious way, but my subconscious said no, because it does not heal, and then I realized that I had to work on myself, to convince myself of what I feel, to be attentive to all those states that I have, to the relationships I have with the people around me, and not to be a victim anymore, because it is not the case.
Here I want to make a point, and to appreciate you, and to tell you that in fact I identified you as a dominant person, that is, a very intelligent, strong person, and that you can impose yourself in the eyes of others. Only that what you lack. Something was missing, and from here the disease developed. Something is missing. It is due to the renal infections that I showed you at the end, and many infections, because you didn't have one, you had multiple renal infections that I took out one by one. You didn't have the courage to go out and tell others that you know the truth about things and that they should listen to you. Because a dominator is a leader who comes forward and who imposes himself through his knowledge, through his courage, through the qualities he has. He imposes his point of view on the others, especially if his point of view is correct, and then the others accept him. You know the truth, and in fact you didn't go out to say it, and you know that the leaders are always in the light of the spotlight. The problem is that you didn't manage to go out in the light of the spotlight. Somehow your ego, your mind wanted this, because you were good and you know that you are smart. The problem is that you were afraid. You didn't have the courage to impose yourself, to tell others that you are not good, to tell others to shut up, to be a leader. And then the victimizer dominator is a person who wants to attract attention, without wanting to be subconscious. He attracts attention to himself with what he can, and he did it with diseases, with about 5 autoimmune diseases.
Yes, I find myself in your description, and I think that the dominator type comes on the maternal line, because that's how my mother was. And by the way, what you said, that even if she knew the value I had, the value was never recognized.
Exactly.
And there was also self-esteem, and there were many.
Some come out in front of others, with some things. That's why you also have diseases. That's how it looks. How many kilograms did you say? Because I knew that I healed you. I personally received your healing when I heard that you said kilograms. Then I calmed down, because honestly I was also a little worried, and you caught that you healed yourself. Now, in that answer you gave me on WhatsApp, how many kilograms did you say?
I put 4.2 kilograms when I started to weigh myself. In fact, when I first came to you, I was 40 kilograms, from 58 kilograms.
That is, you were a weightlifter.
That is, I was a weightlifter, and I put very little, so I put 1.9 kilograms, but from the moment I started weighing in the office, and until the last meeting, which was now in July, I put 4.2 kilograms. For me it mattered, and you can see it, and you can feel it.
Let's tell those who see us. So the lady didn't want to weigh herself, I put her to weigh herself. She wanted to weigh herself in the office to show them that she was gaining weight, that she didn't want to. Well, I want to interrupt. Thank you very much. I thank you too. I congratulate you for your courage. I congratulate you. I actually love you.
I thank you too, because you gave me the opportunity to share with the others.
And to contribute. Thank you. I greet you. Thank you.
Exceptional.
Thank you very much.
The lady came out in front now also through this courage to film.
Yes, she took the leap for real.
She took the leap for real and helps others to take this leap.